Dr. Bridget Solombo Malawi is here. As we heard last week, the government announced, the Ministry of Health announced that we'll be able to access booster doses for COVID-19 vaccines. Now, we've heard a lot of people really keen to have this. I think it's been a conversation from a lot of people trying to understand when will we get booster doses of vaccines for those who are interested. And so we heard from the minister last week that the MITAG, which is the Malawi Advisory Group on Immunizations, has decided that this possibly we can now start accessing them. So from next week onwards, I'm sure we will start being able to access these vaccines. But just to put us in perspective of who can get back the boosters, when and how. So we haven't heard the official communication from the program, the immunization program. Hopefully we'll get all the details in the next couple of days. We know that they are ready to go, but just want to get all the information. But what I'll be sharing today is just what is there, the evidence that is there coming from globally, and hopefully it'll be aligned to what our government in Malawi will do. So just to understand what a booster dose is, firstly, to put that in perspective, because I think we're just hearing booster and so forth, but the name booster means that you finished your first course of your treatment or your vaccination. So, for example, those who are getting J&J, you had one dose and you finished what is known as the primary series, whereas for those who had AstraZeneca, got 2 doses and finished. So when we talk about boosters, we're talking about the people that got their 2 doses of either Pfizer, got their 2 doses of their AstraZeneca or 1 dose of J&J, and now, after a period of time, they will also be able to access booster doses. So this is really exciting, as we know that other countries, we've even heard of other countries that have now on their 3rd or 4th booster, so that's a lot. And so we're trying to figure out, and it's really exciting that Malawi is now providing this opportunity for us here in Malawi. So when do you get a booster? Now, obviously, as I said, the key thing is to make sure you finished your primary dose, your primary series. And ideally, you're not meant to get it straight after. So, for example, if you got your dose, your first series of doses last week, you're not meant to be getting your booster this week, because that's not how it's working. So ideally, within 2 to 6 months, that's what our government has said, that you'll be able to access the boosters. So really do wait it out. Don't just go to get your booster immediately after you've gotten when you finished your primary dose. You do need to give your body time. And that's because the point of a booster is to re-elevate your immunity back to where it was. And usually in the first 3 months, your immunity is pretty good straight after your last dose. So really, there isn't a need for you to get a booster dose immediately after you finished like your 2nd dose of AstraZeneca or your 1st dose of J&J. So you do need to wait a little bit of time before you start to see that waning of immunity. The reason we're giving boosters, and that's what we're seeing on the global scene, is that we do know that after a period of time, usually after 6 months or so, that the immunity that comes from the vaccines is starting to wane. We also know that because there are all these new variants that are coming up, we've seen obviously with time how these new variants can affect how the vaccine efficiency and effectiveness is working in your body. So really the point is that we know your first series of vaccinations was great, it was useful, but just in case after a period of time that you might experience this slight reduction of your protection, that's just to put it back up to where it was. And what we've seen from the data that we have as of December 2021, because we do have World Health Organization, what is known as the SAGE, the Strategic Advisory Group of experts on immunizations, what they released is that what they're finding from the data globally is that the reduction is not significant. It's not like it comes down to 0. Across all age groups, it's coming down to by about 8%. So, if your AstraZeneca dose was around 90%, it's probably going to be like 80, 82, not exactly, but just give you a sample of what that means. So we're not saying that your vaccines are ineffective at all. And also we do know that at whatever stage you got the vaccine, most people that are getting most sick, we saw that even in data in Malawi, the people that are getting most sick, most admitted and dying are usually those who are not vaccinated. And although there's some who are getting sick when they're vaccinated, they're usually not getting very sick and definitely not that many are dying or being admitted. So just to reassure you, we're not saying that the vaccines are no longer working. The boosters is really just to push it back up, that loss of about 8 to 10%. We do know that in some groups, like, for example, older people or people who have an immunocompromised state for whatever reasons, often their immunity reduces much quicker than others. So even in older age groups, about 50, their reduction was around 10%, so more than the 8% across all ages. So this is important because Again, just to re-emphasize, your vaccines, whether you got your 1 dose of J&J or your 2 doses of AstraZeneca, those are good. But just in case, it's been a period of time. Some of us now, we're hitting a year since we got our vaccines. So maybe it is time to try and consider getting your booster doses. So now that we've explained all of that, like when do you get it? Well, as I've said, 2 to 6 months as per the government. What should you get? Now, this is an important one because we are waiting on our government to give advice about what way they go. From the World Health Organization, SAGE, they indicated that you can get the same vaccine, so what is known as homologous boosters. So let's say, for example, there are some countries that even if you got 2 doses of AstraZeneca, you can get a 3rd dose of AstraZeneca as a booster. We can also, and we're seeing this from our government, that they've advised that because of the evidence that's coming back about J&J, that they're advising that those who got their 1 dose of J&J will be getting a 2nd dose as a booster, and then proceeding onwards, anyone getting J&J will just be like J&J will just need a 2-dose vaccine. So you're seeing this is known as homologous because you're getting the same type of vaccine as a booster. But we also know that globally there's a lot of shift and a lot of data that's coming out around mixing and matching vaccines. So that is known as heterogeneous vaccination or boosting. And that is when, if you got AstraZeneca, you can get a different type of vaccine as your booster. And the key advice for this one is to make sure that you're using a different platform. For example, if you got AstraZeneca, it's probably better for you to use Pfizer because it's a very different type of vaccine. AstraZeneca and J&J actually have a similar type of platform. They're both vector vaccines using a very similar type of platform. So similarly, like for example, it's kind of like using the same pala, using, if you're thinking of cooking, I like cooking. So you know that sometimes you're cooking your sima, you might make it a bit hard and you add something else versus you make it a bit softer, but they're using the same kind of platform. That's what J&J and AstraZeneca are like. Whereas like Pfizer is completely different, it's an mRNA, so it's a very different type of vaccine. And that's why other countries are promoting this kind of mix and match boosting. So we're seeing that across the board. And my sense is that a lot of it's potentially that we will be able to see the country advise for this heterogeneous boosting, because that also has been seen in some other studies that if you get one type of vaccine first and then you get another one, it's like training your immunity in 2 different ways, right? So it's like training your army. One, they were training using guns, and another one they're now using grenades. So they're now using 2 different methods and they can fight the same infection. And we've seen that in some cases that's been able to boost your immunity much higher. Although there are very few studies, but that's some of the studies that we're seeing. So we will wait to hear from our government about what advice they'll give us about what type of boosters we're getting, when to get them. But again, just to emphasize that it's possible that for some people you will be able to get the same type of vaccine, especially those who had J&J initially, and then we'll hear what advice they'll give for us about those who've had either Pfizer or AstraZeneca, but likely it'll be this heterogeneous type of vaccination boost. So who should get it? Now, this is an interesting question. It's also a little bit contentious, and I'll explain that later as well. But ideally, we do advise anyone who is at least most at risk. And so most of the advice, especially even from the SAGE as well, was to say that if you're older, so the adults, especially those above the age of 50, those are most at risk. And also because, as I explained, their immunity starts to get down a little bit faster than others, we would advise those to get their vaccination earlier or their boosters because they're most at risk. Other groups like health workers or social workers, those who interact with people a lot more, because they're also at higher risk, those ones at higher risk should also be getting their vaccines. And obviously in our setup, anyone with any chronic infections or diseases, especially those who potentially have had severe illness before, those are potentially people who should be thinking around getting a booster if they got the vaccine. But the country has not been very strict, and I guess we've seen that already in the way that they've communicated. They've indicated those who want, so that if you're a young person, 20, 30, you had your vaccines, but you still want to get that extra protection, you're not going to be barred from it. But again, priority will probably, not that they'll send you away, but I think prioritize if you've got grandparents or people who are at higher risk, then it's better to promote for them to get this booster doses because that's most important. So we've gone through what the booster is. We've gone through why this evidence is being promoted. We've gone through who can get it and when you can get it. a lot of people are asking, where can I get it? And again, my understanding so far is that any place which is already providing any of the vaccinations will be giving us information to be able to get these boosters. Ideally, likely take your full vaccination card so that they can see it and refer back and utilize that for data, any other data updates that they need to do. So those are areas where I'm sure we'll be hearing more from our Ministry of Health in terms of where exactly to go, what other documentation you need, but ideally at least take your vaccination card. I hope this has been helpful. Just to finally say, as I've said, that the boosters are now promoted by the Malawi government. We do know that our uptake for vaccination is still low. So although we are doing boosters for those who want and those who are most in need, we would also like to encourage those who haven't received their vaccines yet to try and get one. Again, this is a promotion because we know that Malawi has still not reached that 20 or 30%, or actually our ideal number was 60% of our target population. We're still below 20, so there's still a lot of work to be done. So although people will be accessing boosters because they might be in need, it's also important to encourage those who might still not have had vaccinations to get their first dose or second dose or whatever they've had, and so that they can complete their series. I hope this has been helpful to all of you in terms of understanding booster doses for COVID-19 vaccines. Again, as always, continue to get credible information from credible sources. Thank you very much.